Hi everyone, welcome to our lab on mobility in the functional movement screen. So what we're going to talk about today is just what is mobility, what's the purpose of mobility, and then we're going to look at how to assess it. And one of the best ways to assess mobility is through the functional movement screen. So I'm going to give you the tools and the understanding of the test of the functional movement screen, how to assess someone's movements through it, how to score someone's movement through it, and what it can tell us and how it can help us improve people's mobility. So when it comes to mobility, one of the first things we sort of think about with mobility is just movement and what movement restrictions we have based on several different factors. Now, I have a picture here of my little guy when he was 3 years old, and what you can see is he's doing a deep squat. Now, this is one of the first movements that we really learn as children is a deep squat position. And a lot of the times we use it for rest and play and picking things up. And then as we get older, we start losing this position. This is a position we should be able to maintain throughout our entire life. But for various reasons, nowadays those reasons tend to be around sitting too much and not moving enough. We stiffen up, our joints just don't allow for the range of motion to happen that is necessary for us to be able to do a squat. I always use this as a measure of mobility. The functional movement screen, you'll see we use a deep squat, but I always use just, if I don't have time to do a functional movement screen or someone's not interested in paying for functional movement screen but want to do a program, I will just get them to try and do a deep squat. And right off the bat, I can assess their mobility based on what's happening. So a deep squat, we should be able to get into this position. So we should be able to see our knees trace over our toes, our hips going below parallel, our back straight, and our head nicely above our shoulders. And this should be able to be done in a relaxed state without strain or without difficulty. So what we need to do is figure out how did we get away from this position as we get older, and how do we get back to it? Because it is something that is trainable, and it is something that we can restore through the right, correct movement patterns. So another thing to understand about mobility is the kinetic chain. So the kinetic chain plays a key role in not only mobility, but just understanding stability as well, and how the body functions and moves based on the kinetic chain and the stability mobility continuum. So I have the orange circles are what are called stability joints, and the black circles are mobility joints. And so essentially what you'll see is that they go through an alternating pattern from the toe to the foot, to the ankle, to the knee, to the hip, to the lumbar, to the thoracic, to the cervical, to the shoulder, to the elbow, to the wrist, and even down to the fingers. And it basically just alternates. And what happens is we're always going to have a stability joint in between two mobility joints. So essentially what that means is when the ankle is mobile, the knee has to be able to stabilize what's happening at the hip while the foot is moving. All right, so a lot of knee injuries happen because of instability and not being able to control what's happening at the hip and the foot. And that's the same thing when we look at the shoulder. A lot of shoulder injuries happen because of what's going on with something at the thoracic. Same thing with the cervical vertebrae. A lot of the times we have cervical pain that is directly resulted from the thoracic vertebrae. Our scapulas as well are a stability joint too, and so our scapulas need to be able to stabilize what's happening at the thoracic vertebrae and the shoulder. So when we understand the kinetic chain, then we understand a little bit more about that mobility stability continuum. And what essentially needs to happen is before we strengthen anything, we have to be able to stabilize joints, mobilize joints, then we can strengthen. Right? So a lot of the times people are doing strength training on unstable knee joints and immobile hip joints, and they're basically just stacking strength on dysfunction. So we need to be able to understand what that dysfunction is and what happens. Now, when it comes to mobility, I'm sure you've probably seen a lot of mobility drills and a lot of different mobility exercises out there. And you probably see a lot of it is people moving in various positions. I put a bunch of mobility exercises on our Bright Space, and you can see that there's, you put the body into a position and you basically move through that position and you move through the range of motion that that position can create. Now, the biggest issue with mobility is a lot of people don't fully understand why we do mobility training. So most people think that we're doing mobility training to essentially increase range of motion. And they're not incorrect, because that is one of the roles of mobility. But another part of mobility is to improve and decrease dysfunction. Now, we decrease dysfunction by increasing range of motion, but the biggest role to decreasing in dysfunction is by training and working motor learning patterns. So what happens a lot with poor mobility is not just stiffness around the joint with tendons and muscles and ligaments, but it's poor movement patterns that have been created through years and years of misuse. And that's a motor learning problem. So a lot of the times we think mobility is just a muscle joint stiffness problem, but in reality, it is a motor learning problem. The dysfunction around the muscles and the joints are really caused by not having the right type of movement patterns. So another thing that mobility does is it helps retrain motor learning and retrain the movement patterns that are supposed to happen. So sometimes people might have the ability to go through a full squat, but they just don't have the movement pattern down. And so by doing certain mobility exercises, they can quickly increase their mobility around their hip and their ankle, because it's not muscle problems, it's just movement pattern problems. So the stability portion is really only, the mobility portion and the exercises and moving through those movements, it's not just stretching and doing a dynamic warm-up, it's creating movement patterns, and that's something that's important to note. Now, another thing that happens with poor mobility and muscle dysfunction is we get symmetry issues. We get asymmetries. So the right side of the body might function better than the left side of the body. So if we look at something like our hip, some people might have poor movement patterns in their right hip and good movement patterns in their left hip. Well, that's going to create some massive dysfunction, some massive asymmetry, and some potential to injury. Now, why do I have the picture of the statue of David up here? Well, the statue of David is a statue that was created, obviously, years ago by Michelangelo. And what he essentially did was create this sculpture of the perfect body. So when we think about the perfect body, we think about someone with very, lean muscle mass, very, very muscular and very structured. All right, and so that's the perfect body. But the statue of David actually also shows us a lot of the symmetrical problems that humans face. And so if you look at first the way he's standing, the way he's standing is actually a typical way that humans stand, right? So you think about it, we sort of stand and we kind of have this little hip crookedness, right? So we're starting to, put most of our weight, lean most of our weight on the one leg and take weight off this leg. That's a typical way we stand, all right? Now, you can also see that the opposite is happening at the shoulder. So when we lift this hip up, then it drops our shoulder. Okay, and it raises this shoulder. So this is actually a typical human position, and it's a postural issue, and that causes asymmetries. And what a lot of people don't know, and I don't have a picture close up of it, but if you go and search on Google, Statue of David's Achilles tendon, what you'll see right here is it's starting to crack. It's starting to crumble. Because essentially the way he built it, all the weight is on this leg, is on his right leg. All right, so over years and years and years, that has caused fractures in his Achilles tendon by having the hip up, the shoulders down, and the weight coming onto that, bearing on that leg. So if this is happening to a statue, what is it going to do to our body? So if we have these asymmetry issues, like the statue of David, because we stand this way and our shoulders dip and our hips dip, well, that's going to cause some strength deficiencies, and it's going to affect our body. It's going to affect our hip, it's going to affect our shoulder, it's going to affect our ankle. So we need to make sure that our posture is correct, and we have good stability and mobility throughout the body, so we can stand like this and not have any potential ramifications from standing like this, because our movement patterns will be able to correct the movements when we go back out of this position. So that's something that's a real key thing to note, is our muscle deficiencies are sometimes just caused through poor posture. And that's why sitting causes massive mobility issues, standing like this causes massive mobility issues, and just not moving creates massive mobility issues. So how do we evaluate someone's mobility and stability pattern and their movement pattern? Well, one simplistic way is through the functional movement screen. The functional movement screen essentially was created in 2001. It was created by Gray Cook, who was a physiotherapist, and he essentially just put a bunch of important movements together and made it so we could quantify movement patterns. So essentially, we can give someone a number of where their movement patterns are and help with understanding the deficiencies. Now, these tests do capture fundamental movements, so it includes things like deep squats and hurdle steps and inline lunges and shoulder motion. It essentially takes that kinetic chain and looks at the mobility and stability continuum. And then it also looks at what our motor control is within the movement patterns. And I think that's a really important thing because, like I said, mobility is a motor control problem. It's not so much a range of motion problem. So it takes a look at our motor control within the movement patterns, and then it basically looks if we're competent in the basic movements and, of uncomplicated movements with specific skills. So the FMS is something that is used by physios, it's used by strength coaches, professional athletes use it, everyday people use it, recreational athletes, youth athletes. It's a test that could be run by anybody. And why I like to use it is it just, like I said, it just gives me first a quantified number of where they are. But for me, I like the qualitative aspect of it as well. I like to be able to see the movement patterns. I like to be able to see how they look and how they're moving. So the FMS is comprised of 7 movement tests, and they all require balance, mobility, and stability. And so what we're trying to do really is see if someone's mobility and stability is deficient or effective. And if it is effective, and it could be effective in many ways, like you can score, it's scored based on 3 is the best, 2 is in between, and 1 is not great, and 0 is there's pain. So you can score 2s and still be able to strength train. It's when you kind of get into the 0s and the low quality 1s is when you're like, okay, we should probably work on some movement deficiencies before we start stacking strength onto this dysfunction. So it takes you through these 7 movements that are basic mobility and stability patterns, and it will show you weakness, it will show you imbalances, it'll show you asymmetries, and it'll show you what limitations the athlete has. So it is, as I said, it's a good test, and there's a couple things you can do with this test. You can go, they have online courses now where you can become certified to be a FMS tester. You can watch what I'm going to do, and I'm going to teach you how to score this test. And the lab we're going to do is going to be you scoring the test. So you'll get some experience doing it to see if you're interested in it. I always say if you're going to use this test, if you think it is a test that is something that you find value in, then I say go get the certificate, become a level 1 FMS certified person, and then be able to run the test, because it's something that it can be very effective. So what we're going to do is go through each of the tests and look at them in more detail. But before we do that, we have to understand a few of the important anatomical landmarks, because there is some measurement and there is some identification of landmarks that's necessary in order to do the test. So the first one is knowing where the anterior superior iliac spine is. So there will be a test where you have to measure essentially upper leg length, so from mid-patella to the anterior superior iliac spine. So you need to be able to identify that anatomical landmark so you can measure that effectively. Then we need the joint line of the knee or the mid-patella, as well as know where the tibial tuberosity is. Also, we need to be able to identify where the medial malleolus is, as well as the lateral malleolus. So the medial malleolus is obviously the inside, the bump on the inside of the ankle. The lateral is the bump on the outside of the ankle. And then we have to be able to take a hand measurement. So the hand measurement is from the most distal wrist crease to the tip of the middle finger. All right, and this is an important measurement for the shoulder stability or shoulder mobility test. So those are some landmarks to know. And then the next thing we need to go is go over the tests. And so the tests are listed in the next few slides. And we usually do the test in this order. That's the way they teach it. But really, it's up to you. I think as long as you do the deep squat first, you can do the other tests in any order. It doesn't have to be in the direct order. Now, a couple things I like to note about the test, just to let you know. So we're trying to first test their mobility, their stability, their movement patterns, their motor learning. And I like to do this without warm-up. I want to see what their true movement patterns are. No warm-up, no getting the muscles loose, no getting the muscles limber. I want to see if you can move without warming up, because you should be able to. You should be able to get into a squat without having to do a bunch of warm-up exercises. All right, so do the test without warm-up. The second thing to note is footwear. I like to do the test barefoot. I like to be able to see how the foot and the hip interact during these movements, and the only way I can see that is if there's no shoes. The testers who created the test, and when you take the course, if you ever take the course, they'll say have them do it with the footwear that they're going to perform in, which is fine. But like I said, if the person's comfortable with being barefoot during the test, that's how I'm going to do it. So the first test is the deep squat. So the deep squat to me is one of the most fundamental movements that the human body can do. I think everyone should be able to do a full range motion deep squat. If you can't, then it's something you need to work on. So the first thing you want to do is, before you get the athlete or the person to do the test, you want to say to them, please let me know if there's any pain during the following movement. And if at any time you do not understand the instructions, stop me for clarification. We are going to perform each movement one at a time and in a smooth and controlled motion. Please wait for me to confirm that you have the proper setup position, and then I'll signal you to begin the movement. I like to do that at the beginning and just let them know that that kind of goes for the entire test throughout all the exercises. And the pain one's important. You want to make sure that they know, or they communicate you with pain, because anytime there's pain associated with any of these movements, the test is automatically scored a 0. And then if it's a 0, then we need to suggest that you go see a clinical physiotherapist or doctor or someone who can diagnose injuries and figure out what's going on with the pain. Another thing you want to make sure is we know the difference between pain and discomfort. Because discomfort is going to happen, especially if you're trying to go through this range of motion and you're not able to. And discomfort's fine. It's if you're doing the motion and it's like, that hurts, like that's a problem. And that's what we need to be able to identify. So before we go and before I show you the test, I'm just going to explain to you the verbal instructions. So what you want to do is, for consistency throughout all screens, you want to use the script that is actually provided in the manual that I put on Brightspace. So what you want to say for the verbal instructions is you want to say, stand tall with your feet shoulder width apart and toes pointed forward. Grasp the dowel in both hands and place it on top of your head so your shoulders and elbows are at 90 degrees. Press the dowel so that it's directly above your head, while maintaining an upright torso and keeping your heels and the dowel in position. Descend into a squat as deeply as possible. Hold the bottom position for a count of 1 and then return to the starting position. So I like to start off with the verbal instructions, and then what I would do is show them visually what it looks like. So I'd show them myself doing the test. All right. Then what you want to do is watch the person do the test and then score it. So let's start off with this. And one other thing to note is ideally you want the person to doing 3 reps. You want to do 3 reps. You want to take the best looking rep, and you want to score low. And what I mean by score low is, if you're looking at this athlete and it's like, it's close to a 3, it's close to a 2, score to 2. All right, always score low on the FMS test. Okay, so let's watch the anterior view first. So you can see I press the bar or the pipe over my head and I squat down as low as I can. and back up. And then I do it again. I squat down. Now, the lateral view, same thing, press it over, squat down, back up. Keep that position, squat down, maintain that position, squat up. Okay. Now I'm going to go to the next slide and let's watch here. So here's the lateral view. Again, and I'm going to see if you guys notice anything. Okay. And then here, anterior view. Squat down, back up. And again, squat down, back up. Now, you'll probably notice my foot position. My foot position is different in two of the videos. So if we go back to this slide, if we go back, sorry, I went back too far. If we go back here, you're going to see that my foot, my heel, is elevated onto the board, onto the screen board. And then here, you'll see that they're not. And then if we go to the second video, the second slide, you'll see on the lateral view, I have the heels elevated and then I don't here. So why do I do that? Well, that helps with the score. So when I'm doing the deep squat, the first thing you want to do is get them to do the squat without their heels on the board. You want to be able to see if they can do a deep squat with their heel and foot completely on the ground. If they can't, if they struggle, if they can't go through the full range of motion, then you get them to do it on the board. If they have to do the squat on the board, then the highest score they can get is 2. All right, so let's look at what would be considered a 3, what would be considered a 2, and what would be considered a 1. So if we look at what a 3 is, well, if the torso is parallel with the tibia or towards vertical, it's a 3. If the femur is able to go below horizontal, it's a 3. Knees are not tracing inside of the feet, that's a 3, so they're tracing when they're squatting down, they're not going inwards. All right, they're able to trace over the feet. And then if the dowel is aligned over the feet, then that's a 3. So if we look at, sorry, keep going back. If we look at my score here, all right, okay, you can see based on that I would score a 3. My torso is parallel with the tibia or towards vertical. My femur is below horizontal. My knees do not track inside of my feet, and the dowel is aligned over my feet. So right there would be a score of 3. Now, if you're scoring a 2, okay, first off, your heels are going to be on the board. Second, the torso is going to be parallel with the tibia or towards vertical. The femur is below horizontal. The knees do not track inside of the feet. The dowel is aligned over the feet. The heels are elevated. All right? So that is what a 2 is. So essentially a 2 is the same as a 3. The only difference is our heels are elevated. And why that is because some people, if they just elevate their heels a little bit, it'll allow them to go through the full range of motion. So it's always best to try without the heels on the board. Start with heels flat on the ground. Do the squat. If they can't do it, go to heels elevated, and they might be able to do it. And so if it looks the same as what a 3 would be, but their heels are elevated, then it scores a 2. Now, with a 1, A 1, our heels are going to be elevated as well. But the tibia and the torso are not going to be parallel. The femur will not be below horizontal. The knees are going to track inside of the feet, and the dowel is not aligned over the feet. So if any one of those happens, then it is a 1. All right, so it just needs to be 1. And these are all listed in that manual I gave you. And then, of course, if there's any pain during the movement, then it's going to be marked a 0. Now, the next test we'd want to look at is the hurdle step. Or sorry, the inline lunge. So the inline lunge is going to be the second test that we look at here. And so what the inline lunge does is essentially looks at balance, mobility, and our ability to stabilize a movement. So verbal instructions for the inline lunge are going to be step onto the center of the board with the left foot and your toe on the 0 mark. The right heel should be placed according to your tibial measurement. So what we're going to have to do here is actually measure our tibia. So we have to find our tibial tuberosity and measure in inches how far it is from the ground. Once we get that tibial tuberosity measurement, we would then mark that down. Because what we need to do is if we have our left foot at the 0 line, our right heel needs to be placed at that measurement. Then what we're going to do is have both toes pointing forward with the entire foot in contact with the board. We're going to place the dowel along the spine so it touches the back of your head, your upper back, and your tailbone. While grasping the dowel, your left hand should be on the curve of your neck, and the right hand should be in the curve of your lower back. You want to maintain an upright posture so the dowel stays vertical, and you maintain the 3 points of contact. Descend into a lunge position so your left knee touches the center of the board. Then return to the starting position. Then when we switch legs, we basically just repeat, but change the indicated side. So when we're scoring this, if we have our right foot forward, then we're scoring it on the right side. If our left foot is forward, we're scoring it on the left side. So what we're going to do is look at this now, and I'm already going to tell you that this is, what I've done is incorrect, because you want this arm that's behind your head to be opposite of the foot that is in front. So this arm here is the one that should be holding the dowel. So by doing this, I've incorrectly already have changed what the score, what the result is going to be. So if I see an athlete that goes into this position, I would stop them and then I would correct them immediately. All right? So what we'd want to do is if we had everyone in the right position, we would then look at this test and we would see how the athlete does. All right? So you can see we're lunging down, touching our knee to the heel, and then coming back up, and we repeat. Try and maintain control, trying to maintain good pace, trying to be upright. All right, so what we'd want to do here is look at a few things in terms of what the score is. So when it comes to a score of 3, a score of 3, the dowel would be in contact and maintained on those 3 points. The dowel will remain vertical. There'll be minimal to no torso movement. The dowel and the feet will remain in the sagittal plane. The knee touches the center of the board, and the front foot remains in the starting position. So that would be a score of 3. So if we look at my attempts, here, everything aside from my incorrect arm position looks like it should be. So this would be a score of 3. So a score of 2 is if the dowel at any point is not in contact with those 3 spots. And it could be any one of those 3 spots. So if it comes off your tailbone, which is the more typical one, or it comes off your vertebrae, that would be a 2. If the dowel does not remain vertical, so if there's any sort of movement in the dowel, that would be a 2. If there's any movement in the torso, you'd score a 2. If the dowel and the feet do not remain in the sagittal plane, all right, so if something happens and you move it into the frontal plane, or even twisting or rotating it into the transverse, it would be a 2. If the knee does not touch the center of the board, so if you touch it off the board, all right, that would be a 2. And if the flat front foot does not remain in the start position, so if it shifts, moves, it would be a 2. Now, a 1 is at any time there's loss of balance or stepping off the board, it's automatically a 1. If you cannot complete this movement pattern at all, then it is a 1. And if you have any sort of inability to get into the setup position, that's a 1, which a lot of people struggle with. They can't even get into the setup position. If that's the case, then that's a 1. And then, of course, if there's any pain, then it would be a 0. Now, the next test we'll look at is the hurdle step test. Now, the first thing to note about the hurdle test step is you see I have a little wire here. So the test has this little wire here. That wire is what we have to step over. Now, what we need to do, again, is use that tibial measurement, tibial tuberosity measurement, because the tibial measurement will determine the height of that line. So once we get our tibial measurement, that's why we mark it down, and then we will put that line, that string, on the right measurement. So verbal instructions for the hurdle step. Stand tall with your feet together and toes touching the test kit. Grasp the dowel in both hands and place it on top of your head so your shoulders and elbows are at 90 degrees. Then, while maintaining hand position, lower the dowel to the base of your neck and across the shoulders. While keeping an upright torso, raise the right leg and step over the hurdle, making sure to raise the foot towards the shin and maintain foot alignment vertically with the ankle, knee, and hip. Touch the floor with your heel and return to the starting position while maintaining the same alignment. So when it comes to the hurdle step again, what we're scoring is right foot goes over the hurdle, we score right. Left foot goes over the hurdle, we score left. So let's take a look at what this looks like. So there we go. Right foot over, bring it back, step down. Now my knee hit the cord there. That's fine. If it was my foot, then that would change the score. Let's look at the anterior view. Tracing that foot with knee and hip, stepping it over, coming back, returning to the start position. So in order to get a 3, your hips, knees, and ankles must remain aligned in the sagittal plane. So if any of those wander off, then it's not going to be a 3. There should be minimal movement in the lumbar spine, and the dowel and hurdle should remain parallel. A 2, if any of these happens, it's a 2. If the alignment is lost between the hips, knees, and ankles, it's a 2. If there's movement in the lumbar spine, it's a 2. And if the dowel and hurdle do not remain parallel, it would be a 2. Now, to score a 1, we would have to have an inability to clear the cord during the hurdle step. All right, so that means not so much our foot touches it, our foot just can't get over it. If your foot knocks it, but it stays up, I would mark it a 2. But it would have to basically knock it each and every rep. And then, of course, if there's loss of balance, then during this, then you would score a 1. And of course, if an individual receives a score of 0 because of pain, then a medical professional should perform a thorough evaluation of the painful area to figure out what is happening. Okay, the next test we'll look at is the ankle clearing test. Now, the ankle clearing test is one of my favorite screens that the FMS has. I use it a lot. I think it's very effective because it really helps identify if there's any problems with ankle dorsiflexion. And a lot of people struggle with ankle dorsiflexion because of tight ankles and poor movement patterns. So what we're trying to essentially accomplish here is clear the athlete's ankle dorsiflexion. So not give them a score, but give them a clear. Give them a green, yellow, or red when we do this. So the verbal instructions are as follows. Place the outside of your left foot up next to the FMS test kit so that the outside foot is in contact with the kit. Place the right foot in front of the left foot so that you are in a heel-to-toe position with both feet touching each other and the FMS kit, and use a dowel for balance. I will adjust the FMS kit so that the red start line is at the front of the medial malleolus. While maintaining the heel-to-toe position, drop straight down, bending the back knee and taking it as far as possible in front of your toes while keeping the heel down. Once you have reached your maximum distance, I will measure and ask where you felt the stretch, front, back of ankle, or no stretch. All right, so what this test essentially looks like is as follows. So we first identify that medial malleolus and we put it on that red line. And then using something to balance, which is fine, we get the athlete to go as far forward as possible. And what we're watching for is the knee. We're watching to see if the knee is going over top of the medial malleolus. So if we can get that knee over top of the medial malleolus, show you that again and pause it. So if we can get the knee in line with that, sorry, there we go, ignore that first line. If we can get the knee to go past the medial malleolus, then what we would do is give them a green. All right, so we'd clear them completely. We'd give them a green, which means the knee moves beyond the medial malleolus of the front leg while the heel stays down. So this indicates that the ankle has cleared all mobility requirements. If it is not, so if the knee resides within the width of the medial malleolus of the front leg while the heel stays down, we give them a yellow. So this indicates a potential ankle mobility limitations. So failure of the ankle clearing screen implies that the ankle mobility should be addressed and cleared. Now, if we get a red, the individual's knee does not reach the medial malleolus of the front leg while the heel stays down. This will indicate potential ankle mobility limitation, and failure of the clearing implies that we should address it with mobility work. And again, the other additional considerations are pain and stretch. So if there's pain, then we indicate that it's positive for pain in the scoring, and we have to refer to a healthcare professional. Now, as I said, you should ask about the stretch. So if the individual experiences a stretch or feeling of tightness of the ankles and it does not resolve with soft tissue or stretching applications, further assessment by a healthcare professional will be needed. So that's the ankle clearing test. And as I said, it's one of my favorite tests to do, and it's really simplistic, and you don't even need the kit to do it. You just need to put someone heel to toe and see if they can get that knee over top of their ankle. Now, the next one we're going to go through is our shoulder mobility. So our shoulder mobility is as follows. First off, we have a clearing exam to do. Now, the clearing test is going to essentially be a test, a bilateral test, and we are trying to see if they receive a positive score. So we're going to document both sides and the score for both for future reference. Now again, we're looking for pain. Is there a pain associated with the movement? If so, give a score of 0 and perform a thorough evaluation of the shoulder, or refer out. So refer out to a different healthcare provider. So what the clearing test looks like this. You put your left hand, I got my right hand on my left shoulder. Oh, sorry, that's the measurement. You put your right hand on your left shoulder and you lift your elbow up as high as you can. If there's pain, the athlete will tell you. If there's not, it's fine. This event essentially is seeing if there's any shoulder impingement issues. Then the next thing we want to do is measure the palm of the hand to the middle finger. So we do that first crease at the bottom of the palm, and then we measure all the way up to the tip of the pinky, or the middle finger, sorry. And then what we do is mark that down because we're going to need that for the evaluation, and we do that in inches. So the verbal instructions are: stand tall with your feet together and arms hanging comfortably. Make a fist so your fingers are around your thumbs. In one motion, reach the right fist over the head and down your back as far as possible, while simultaneously reaching your left fist up your back as far as possible. And you do not want to creep your hands closer. You need to mark it at the initial placement. So this is what the start of the test looks like. And then what you want to get them to do is one arm over, one arm under, and then return. Then go again. What I usually do is get them to do it 3 times and score the 3rd time, because the 3rd time is always further. All right? So let's rewind that back and let's pause it at the point there. All right? So this is what we're looking for. So now what we do from here is measure that distance between the fists. And it's the closest points of the fist, of the 2 fists. So that would be here to here. So that is the distance we're measuring. Now, if the score is a 3, we would see that the fists are within 1 hand length. If it's a 2, the fists are within 1.5 hand lengths. And if it's a 1, the fists are not within 1.5 lengths. So that's how we score 3, 2, 1 in this test. And then again, if there's any pain during that movement, we mark that down. Now the next test we want to do is an active straight leg test. Another very applicable test that I like a lot. Essentially it just tests your hamstring flexibility. It tests range of motion. So first thing you want to do is measure that ASIS, the anterior superior iliac spine, with the midline of your knee, in the midpoint of the patella. So you take measuring tape or the measuring tool that they give you in the FMS kit, and you measure the 2 points. And what you want to mark down is the middle of that. So once you mark that middle point of that length, that's where you're going to place the pole, because that's what we're going to use as our measuring point when we do the test. So then we're going to get the athlete to lay down and give them the verbal instructions. So the verbal instructions are as follows: lay flat with the back of your knees against the board, feet together with toes pointing up. Place both arms next to your body with your palms facing up. With the scoring leg, remaining straight, and the back of the opposite knee maintaining contact with the board, raise your scoring leg as high as possible. So if we're raising our right leg, we're scoring the right side. If we're raising our left leg, we're scoring the left side. So this is what the test is going to look like, and what we're looking for is as follows. Okay? We want to see if the vertical line of the malleolus resides between the mid-thigh and the ASIS, and the non-moving limb remains in a neutral position. So if you look at my test, if you look at my test, you can see my resting leg stays on the board, and my malleolus goes beyond that midline of the thigh. So that would be a 3. So the vertical line of the malleolus resides between mid-thigh and the ASIS, and the non-moving limb remains neutral position. That would be a score of 3. 2 would be if the vertical line of the malleolus resides between the mid-thigh and the joint line. So it doesn't quite get to that midline, but it goes beyond the knee. And then the non-moving limb remains in a neutral position. 1 is vertical line of the malleolus resides below the joint line, and the non-moving limb remains in the neutral position. So what you need to watch for is if they're doing the test, and that resting leg moves, help them out and say that resting leg needs to stay. And then try and get them to do it again. And that might completely change the score of the test. That resting leg must remain neutral throughout the test. And then, of course, if there's any pain, we mark it as 0. That brings us to the trunk stability push-up. Now, the trunk stability push-up has a clearing exam as well, and it's extension clearing exam, and it's performed as a press-up from the floor with the hands under the shoulder. If there's any pain associated with the motion, then we give them a positive score and mark that down. So what that looks like, what this clearing looks like, is we just essentially push our chest and torso off the ground while our lower body stays. If we can do that without any pain, we're cleared. We can do the trunk stability push-up. If we have pain in that, then we can't do this test and we mark it as 0. Now, what we want to do for the test is the verbal instructions are as follow. Lie face down with arms extended overhead and shoulder width apart. Pull your thumbs down in line with your forehead for males, chin for women. With your legs together, pull your toes towards your shins. Extend your knees and then lift your elbows slightly off the ground. While maintaining a rigid torso, push your body as one unit into a push-up position. So we have to have the various positions. So for men, you start at the forehead. For women, we start at the chin. So once we have those starting points, then we do the test. A score of 3 is for males. If it's performed, you perform a repetition with thumbs aligned with the top of the forehead. And you can maintain your body lift and there's no lag in the spine. For females, if the repetition is performed with thumbs aligned with the chin, then you score 3. Now, a 2 means the male cannot do a proper push-up with the thumbs aligned at the forehead. So we then align with the chin. If they can do that and there's no lag and the lift is strong, then it's a 2. For females, we drop the thumb to align with the clavicle. That would be a 2. Now, a 1 is if the men are unable to perform a repetition with the thumb aligned to the chin. For females, if the women are unable to perform a repetition with the thumb with their clavicle, we score a 1. And then, of course, if there's any pain during the motion, we get a 0. All right, and that's going to take us to the last test, the rotary stability test. So the rotary stability test is as follows, and this is by far the most difficult test. I personally think it's the least applicable. I don't care for it. I still do it because you need to do it to get the score, but I find it very difficult for athletes to score 3 on this test. Most of them score a 2. So verbal instructions are as follows. Get down on your hands and knees, straddling the board with your thumbs and knees and torso touching the board. Your hands are under your shoulders and your knees are under your hips with your toes pointing backwards. At the same time, in one smooth and controlled motion, shift and lift the same side arm and leg. Without touching down, reach back with your hand and touch the outside of your ankle, or the lateral malleolus. Then extend the same side, that same side leg backwards and arm forward, fully extending the knee and the elbow. Finally, reach back to touch the ankle with the hand again, and then return to the starting position. Perform this pattern while keeping the arm and leg moving within the board. So that is what the rotary stability verbal instructions are. There is a clearing test to this as well, and the clearing test is a flexion test, so it's the opposite of what we just did with the push-up test. And so it looks like this. All right, so we basically drop our hips down towards our feet, and if there's any pain in that motion, we automatically mark a 0. If there's no pain, then we continue the test. Now, here's what the test looks like. As I said, very difficult test. So we take our arms and our legs, we extend them behind, we reach, we touch our ankle, we extend back, and we drop down. All right, so that's how the test should look. So a 3 is if the hand and knee leaves the ground at the same time. The ability to perform this pattern is you're able to perform this pattern while keeping the arm and leg moving in line and parallel with the board. The fingers touch the lateral malleolus. The knee and elbow achieve full extension. So if all of that happens, we score a 3. A 2 would be as if the hand and knee did not leave the ground at the same time. There's an inability to keep the arm and leg moving in line and parallel from the board. Fingers touch the lateral malleolus. The knee and elbow achieve full extension. That would be a 2. So it's basically if we can do this pattern but we're not really in line with the board. So we have to lean way over to one side to make this pattern happen. If that's the case, then we score a 2. And then 1 essentially is loss of balance. We can't touch the lateral malleolus. Our knee and elbow don't fully extend. And we're really have an inability to get into the setup position. That would be a 1. So anything that goes beyond what a 2 and a 3 looks like. And then, of course, if there's any pain, we score a 0. So that's the rotary stability. That's the last test. And when the right arm is forward and the right leg is back, we're obviously scoring the right side, and then vice versa. So scoring the test looks like this. This is what a score could look like. So this athlete here scored a 1 in the rotary stability, a 2 on both sides of the inline lunge, a 2 on both sides of the hurdle step, a 2 with deep squat, 3 active straight leg, 3 on both sides of shoulder mobility, and 3 with a trunk stability push-up, for a total score of 16. So that's what the scoring would look like. And you can see there's like the green and the red. So essentially that just means with the green, this athlete can perform strength exercises that are similar to that movement pattern, but need some mobility work associated with it. The 1, the red, means we shouldn't be stacking strength on poor mobility and stability. And so we need some work on that rotary stability. So that's technically what the score means. Again, I take that with a grain of salt personally. I'm not going to take a really, athletic person that scores very well and then scored poorly on one test and say, sorry, you can't do any strength training. I think in the athletic population, I think most athletes, we can carefully build strength, even if they have some poor movement patterns, but definitely work those movement patterns into your program. Someone who is, not in the athletic population, I would suggest to work the movement patterns before we really start doing a lot of strength training if they have any reds on their scores or any 1s on their scores. All right, so what I'm going to do is I will post some videos of a test being done. You will, in the lab, mark the score, what you think the score is of those tests, tally it up and give a total, and then there will be some questions associated with that as well. And what I'll do is there will be a grading or a marking sheet so you can use to score the test. This one particular one here I have is from the FMS app, which certified members get access to. It just makes it easier to score and send them the score and everything like that and keep track of it. So that's the FMS test. If you have any questions on it, please let me know. I'll get the lab assignment up as well, and then you can start working on that. And I hope everyone has a fantastic day, and we'll talk soon.